you have to seek contacts with other institutions, not only in your area, but also internationally. And go to the surgery room and watch how people perform surgery. You might not agree to all what you see, but you can differentiate what you are doing and what has been done there. And then when you go home, you bring that what you learned and what you picked up, you bring back to your own institution.
Assalamualaikum warahmatullahi wabarakatuh. Selamat malam. Selamat berjumpa lagi di Instagram Live dari Perkina, Perkumpulan Kontinensia Indonesia. Dan hari ini saya juga ingin mengucapkan selamat Hari Batik Nasional yang jatuh pada tanggal 2 Oktober pada hari ini. Masih dalam rangka ulang tahun Perkina yang ke-20, di mana Perkina ini didirikan di Jakarta pada tanggal 19 Agustus 2000. Saya akan kedatangan tamu spesial, yaitu Profesor Udo Yonas, MD, PhD. Beliau adalah guru saya, dan beliau adalah seorang spesialis urologi yang mendalami pendidikannya di Mainz, Jerman. Kemudian pada tahun 1980 beliau menjadi Chairman of Department of Urology di University of Leiden di Belanda. Kemudian di tahun 1987 beliau menjadi Chairman of Department of Urology and Pediatric Urology di Hannover Medical School. Tempat bersejarah ini karena ini adalah tempat saya mengambil S3 saya di Jerman di tahun 2007, dan beliau juga sebagai promotor S3 saya waktu itu.
Yes, I'm here.
Hello, Pastor.
Hello, Rita.
Hello.
Nice to see you again after so many years you spent in Hanover. Welcome.
Yes. I think it was the best years of my life. I think one of the best years of my life.
Oh, I'm very
happy that you're wearing batik today.
Excuse me?
I see that you are wearing batik today.
Well, an important occasion in Indonesia, I have to have my Indonesian uniform.
Yes. And you know that today is the National Batik Day, so your outfit is perfect.
I picked the right shirt today, yeah?
Okay, Professor. So the topic for tonight is the importance of sustainable international collaboration. And I believe that you have a very close collaboration with Indonesia, especially with the urology department and also with the Indonesian Continent Society. Can you tell us a little bit about that and why it is important to have international collaboration?
Well, let me go back to 40 years. The first time I met Indonesian urologist, it was the late Professor Utama with your father, Dr. Joko. And it was when I was still in the staff of Mainz University with Professor Hohenfellner. It was August 9th, 1979. I remember this date very clear because it was a very emotional situation for me. August is a typical holiday month in Germany, so I was the only from the staff member who had to stay home to run the clinics. And at this specific day, my father passed away in Vienna, and I was stuck in Mainz and I couldn't leave. But later on, I thought my father would be very happy seeing that on his day when he passed away, we started a fruitful cooperation between myself and Joko and German urology and Dutch urology and Indonesian urology. So I think it was an emotional start, but it was a good start. And looking back to the 40 years, it was a very sustained and very efficient, very successful time. I don't think it's only the question how you perform professionally. It's also the question how you come along socially, and especially with your family and the other friends from Jakarta in Indonesia became friends to me, and I felt always home going back to Indonesia. either in Jakarta or Sumatra or Bali. You might remember you were still a small kid that we spent holidays together. And this is also a very big point in international collaboration that you develop friendship. On the professional side, we had arranged to make an exchange program for Indonesian fellows. So the first one was Rohani, who came to Leiden, and I remember it was a November day, and he saw for the first time in his life, he saw snow. And when he saw a plane coming over Leiden, he said, when I see these planes, I'm somewhat homesick. I would like to go back. But at the end, he enjoyed being with us, and he performed very well and very successfully. Then Firdaus came, and then the late Ali Afandi. And then Ahmad Taha was planned to come to Leiden. But at this same time, I got the appointment in Hanover. So he came to Hanover, and he was one of the three musketeers who performed very well research, like Akbar, Poncho, and especially you, Rina. And I'm very proud that you stayed with us, because all of these people made a very good professional career, and they succeeded very well in Indonesia. And I was very happy when I came to Taha's promotion in Jakarta, and certainly your wedding in 2013. So this is two phases of a collaboration and a friendship, and I think this is very important to have international collaboration, because we should not think on a local area or a national base. We have to look internationally, and this is what is successful on the long run.
Yeah. And you were also present when the Indonesian Continent Society was founded in the year 2000. Can you tell us a little bit about your role in this meeting 20 years ago? Were you a founding member also?
Well, I certainly remember this meeting in Jakarta, and I think I recall right that I was also in Chipta. We performed some incontinence surgery. I think it was a sling procedure, and my role in the establishing and the building up of this society in Indonesia was that I could bring some of my experience, which I gained on the German national way with the Deutsche Inkontinenzgesellschaft, later on the European level with the section on female infantile urology. So this was what I could bring, because I think it is very important that different countries have their own continence society, because it's a very specific field inside the field of urology, which has to be especially attended. And so I think you already proved in the last 20 years that your society, your incontinence society, was a very successful one.
Yeah. So do you think it is really important to have such a society in one's country, a continent society in one's country, like in Germany also?
Yeah, I think it is very, very important. But the smaller societies, which are very specified and only cover a short spectrum of urology, should be embedded in the local general association of urology in each country. And furthermore, you have to look over the border, and has to be embedded in an international, not even in a European or Asian one. It has to be in a global connection. This is going to bring the success to this society.
Yes. So in your opinion, Professor, in 20 years' time, what do you think has changed in the field of functional or incontinence surgery or pharmacological treatment? I mean, in terms of diagnostic and therapy. Can you tell us a little bit about the situation in Europe or Germany?
Yeah, well, there's, generally spoken, it's a continuous improvement. There are always new things coming up. But this might lead to a danger that very often industry want to push to sell a product, and it's our concern and our responsibility on the sake of the patient, what we are looking for, that we have to channelize these new products and see what is good, what is bad. And if you look back to the last years, and that's worldwide the same, a lot of new technologies came, and a lot of them went off again. And after a couple of years, nobody spoke anymore of these things. So our responsibility is to serve our patient, to see what is best for them. And we have to be very keen and very careful what kind of new technology, especially when I talk about alloplastics, we have to introduce. And I'm an older man already, and we are based very much on not so much on the artificial things, but on the organ defined substitution for these patients. And I think we should have a very much concern that this has to be done. However, I retired already in 2008 from my post as chairman, and so I cannot very much go into the latest developments because I'm out of urology.
Okay, that is a very good point, Professor, considering that a lot of new technologies are already emerging for the incontinence surgery. And then I also read an interesting fact that you got your PhD title in neurourology. So how important is research, do you think? Is either clinical studies or basic research in the functional or neurology or incontinence field in terms of therapy for the patients with incontinence?
Well, I think neurourology is an integrated part of functional urology because everything is controlled and driven by our nerve system. Independent if you talk of neurogenic disease or non-neurogenic disease, which leads to this functional disturbance what we have. You know that I was involved in the design of the sacral nerve stimulator for controlling bladder evacuation. This is to be done on two different ways for the neurogenics and the non-neurogenic patients. And so the neurourology is an integrated part of functional urology.
Yes,
and all research has to be focused on neurourology also.
Okay, Prof. So looking back to the history and for the last 20 years, what are your hopes for the Indonesian Continence Society or the management of incontinence generally in the future?
Well, in the future, it will be a continuation of. Okay, I'm back again now. I was a little out of focus. Okay. No, I think every effort, every research, and every clinical activity as far as diagnosis and treatment concerned are in a continuous progress. And you see, technology gives us more and more new technique. And again, we have to be very keen and aware that we have not to represent private companies, but we have to represent our patients. And this is what we need. And the effort will certainly go in the future to have more and more new techniques coming up. But never forget that if you look back in literature, a lot of those things which were new designed have been already done 20, 30 years ago.
Yeah. And then this probably is the last question. You are a well-known urologist in Europe and maybe and in the world maybe, and was the chief of Department of Urology in Hannover Medical School, a very respected hospital in Germany for 20 years, Prof. Do you have any messages, take-home messages for us urologists, young urologists in Indonesia?
Well, I can give you a message not to the young urology in Indonesia, but to all residents in urology, and I thought to teach all my residents the same way. It is very important that you read English, that you can follow the literature, because most of the good literature is written in English. Second, you have to see contacts with other institutions, not only in your area, but also internationally. And go to the surgery room and watch how people perform surgery. You might not agree to all what you see, but you can differentiate what you are doing and what has been done there. And then when you go home, you bring that what you learned and what you picked up, you bring back to your own institution. And this will lead to a better understanding, maybe an improvement of your own technologies. But never be arrogant that you say, well, I'm coming from a big institution. We have all the technologies what we can have if you go to the remote areas. I remember I was with your father in Padang in Sumatra many years ago, and we went to a small hospital, and I saw that these people, they hardly had any X-ray equipment, and they did such a perfect operation. And I think the craftsmanship is what counts, especially in those countries, and that you have to be aware when you go and look. But look with open eyes, have a criticism, come back and try to implement it in your own setup. And so be open to all alternatives. At the end, you make your own mind, but you can judge on what you saw on different areas before. These are some suggestions I can do being an old man in urology.
Thank you very much, Professor Jonas. This was an inspiring interview. I hope that we can meet again very soon. I hope the situation in the world will get better soon. And I hope you and your family are in good health. And say hi to Irina for me. And I will close this session. So choose. Auf
Thank you.
Wiedersehen, Professor. See
Auf
you.
Wiedersehen. Thank you very much. Say hello to all
Thank
your
you very
family. Hope to see you again soon.
Hope to
Bye-bye.
see you again soon. Bye-bye.